Assalamu alaikum. As part of the BIMA Mental Health and Lockdown series, today we are following Adam, Miss Khan's 12-year-old son. Since school closed, Adam sits at home with his grandmother and has been watching a lot of TV. Surprisingly, he's been playing this PlayStation less often recently. He's been asking more and more questions about COVID-19 and often asks about how many people have died and if any of his extended family members are unwell. He tends to get impatient and angry easily, often ending up fighting with his siblings. He is constantly washing his hands and spending quite a long time doing this. He admits that he worries about his father, who is a doctor in the NHS. He finds himself worrying that bad things will happen, and so finds it really difficult to fall asleep, but does so eventually with a lot of reassurance. These are some symptoms of anxiety. Many people will be feeling this because of the threat from the current pandemic and the biggest changes to our lives while having to stay indoors. Some people experience these symptoms constantly, even when there isn't anything obvious to worry about. They often need to see their doctor for support. Normally, in Ramadan, Adam would be meeting up with his cousins during iftari and seeing his friends in the mosque when he goes to read Taraweeh. But having Ramadan at home doesn't mean this interaction needs to stop, and making sure he is speaking to his family and friends will go a long way in helping his anxiety. Having virtual iftaris is a good way of meeting up with family members. Setting up a video call before iftari, maybe even doing a dua together with the extended family. You can even virtually open your fast together. Playing on the computer can be good but in moderation. It helps maintain the social contact that Adam will be missing but too much can have an effect on his concentration and sleep pattern. It is very important to limit children's consumption of the media, but if they do ask them, it is important to explain the situation honestly and in language that they understand. Children are normally very active, and just as staying healthy is a sunnah. It is important we should encourage them to go out to play and get some fresh air, while making sure social distancing measures are followed. If you have a garden, then there is endless amounts of fun that you can have, whether it is playing sports, building a tent, or you could even try acting out some of the stories of the prophets. If children are having trouble going to sleep, it is important that they still continue to go to bed at the same time and avoid any screen time or food and drink before bed. Having a routine is very important in normal circumstances for healthy development, and in these difficult circumstances to bring some stability to their lives. It's important to take steps to manage symptoms of anxiety, otherwise, they can become very troublesome. If you or a family member are struggling, then do reach out and contact your GP or local mental health services.